Welcome to the American Society of Plastic Surgeons Roundtable. I'm Caitlin Clark, and I'm joined by three prominent plastic surgeons and American Society of Plastic Surgeons members. Dr. Gregory Greco is an award-winning plastic surgeon with offices in New York City and New Jersey. He's also the president of the American Society of Plastic Surgeons. Dr. Michelle Shermack is a plastic surgeon with a practice in Baltimore. She also serves as vice chair of the ASPS Public Education Committee. Dr. Michelle D'Souza is a plastic surgeon who specializes in both reconstructive and aesthetic procedures in Kansas. She's also an associate professor of plastic, burn, and wound surgery at the University of Kansas Health System. And we're all here today to discuss the misconceptions surrounding plastic surgery and to set the record straight. To get started, let's start with perhaps the biggest misconception of all. What is plastic surgery? Dr. Greco, when people hear the words plastic surgery, everyone's mind immediately goes to cosmetic procedures. Why do you think that is?
Thank you for the question, Caitlin. I think when people hear the words plastic surgery, unfortunately, I think whether it's our profession, whether it's the media, whether it's the public, we've compartmentalized the world of plastic surgery, and all we think about is cosmetic surgery. And we all know, certainly as plastic surgeons, the realm of plastic surgery, from the vast amount of reconstructive procedures that we do, it seems like the general perception to the public, though, always focuses on the cosmetic surgery portion of it. So, I think tonight, hopefully we're here to set the record straight and talk about all the great things we do as plastic surgeons, including cosmetic surgery and the life-changing experience that our patients have throughout this. So it's great news, and I think that the media outlets love a good plastic surgery story, and unfortunately it focuses, especially with social media these days, where tend to be drawn to the plastic surgical newsworthy stuff, whether it's for the better or for the worse, or people making comparisons about people's plastic surgery. So again, I think there's so much more good that we do as plastic surgeons, and that should be newsworthy, but maybe it's not as consumer friendly, if you will. So.
Mm-hmm. We're going to change that because that philosophy is reductive at best. And so on that note, Dr. Shermack, there are so many different subsections under the plastic surgery umbrella. So what all does plastic surgery encompass?
So thank you for that question. Plastic surgery, actually the title, the term comes from the Greek plastikos, which means to mold. And basically plastic surgery, we say is surgery on the skin and all of its contents, essentially. And many of us, particularly who work with other disciplines, are the people who are brought in to really kind of put the icing on the cake and really kind of complete a procedure so that the patients end up, fully restored. Plastic surgery is comprised of reconstructive surgery and aesthetic surgery. Reconstructive surgery includes reconstruction of traumatic injuries, of burns, reconstructing patients who have cancer removals, and even hand surgery is a subspecialty of plastic surgery. And then we have, as Dr. Greco noted, our more kind of, I guess, popular and at least to the media is aesthetic surgery. And we perform aesthetic surgery really from head to toe. Plastic surgery training is quite intensive, long. I think about all that we went through, and thank God we don't have to do it again, and we don't have to. But first of all, we all do 4 years of either medical school or osteopathic school. And after that, residency training typically on average takes about 6 years. Excuse me, we get exposure to general surgery subspecialties, and these include areas like trauma, intensive care, cancer services, things that many don't associate with plastic surgeons and what they do, but that's an integral part of our training. And then we also train in subspecialties that include dermatology, ophthalmology, ENT, anesthesia. So we really, again, kind of not only learn these specialties, but develop these important relationships, because we're often brought in to assist in really getting the surgical procedures and reconstructions really like over the top and finessed. Many plastic surgeons do fellowship training. Those fellowships can include aesthetic surgery, hand surgery, complex reconstructive surgery that people go to some of the big cancer centers across the country. Many of us do research training as well. So this is all probably news to everybody. We do research in tissue engineering, reconstructing new tissues. We do outcomes research. We can also do basic science research. So plastic surgery is almost like, I'd say, an iceberg where you only see the tip, but there is just so much more going on below the surface that many people aren't aware of. And then, of course, any member of the ASPS, the American Society of Plastic Surgeons, is board certified. And board certification is a whole other area. There's an umbrella organization called the American Board of Medical Specialties. There are only 24 members of the ABMS, and the American Board of Plastic Surgeons is a member. This is not a cosmetic surgery board. This is not an aesthetic surgery board. This is the American Board of Plastic Surgery. So there is a lot of confusion, and unfortunately, some people do take advantage of that confusion. But I hope that answers that question. It's a long-winded answer, but I think all of that information is really important for the public to know.
Absolutely. Thank you for that clarification. It is really important to know, especially the differences between a board certified plastic surgeon and, as you mentioned, a aesthetic surgeon or a cosmetic surgeon. And so on that note, Dr. D'Souza, you founded a mixed reconstructive and aesthetic practice, and you are an associate professor for plastic, burn, and wound surgery. Do you find that these limiting beliefs about plastic surgery are detrimental, as there is definitely a functional side to plastic surgery?
Well, my practice is unique because I'm at a teaching hospital, and it's a tertiary care medical center. So because of that, we are working with all the other specialties to help restore function and rebuild patients, and fix after tumor resections to fix their defects. So half of my practice is just reconstruction surgery. But in this location, because I'm in a tertiary care medical center, I think a lot of people don't realize that we're trained in both cosmetic and reconstructive surgery. So I do both 50-50 reconstruction and cosmetic surgery. So I have a nice blend of both sides of plastic surgery. But I think outside of the university and the teaching hospital, we are kind of, like Dr. Greco had said, compartmentalized into what people see on social media. In reality, we're broadly trained from head to toe, inside and outside, and on any gender and any age of patients. So that's part of the training that we received.
And Dr. Greco, you and I discussed this example previously, where a family member of mine was in an accident years ago, and one side of his face was rebuilt with metal plates. And I asked him who his plastic surgeon was, and he said, "Oh, I didn't have plastic surgery." And you kind of chuckled. So what was your reaction to that? Do you find that that's a common belief from patients, that they almost don't believe they've had plastic surgery when it's reconstructive?
Thank you for that question, Katie. Yeah, I think it's one of those things. Once again, this is about nomenclature. This is about, how we, the semantics of what plastic surgery is. I think if you had surgery performed by a plastic surgeon, you had plastic surgery, which spans the realm of plastic surgery, which Dr. Shermack so eloquently elucidated for us. That I think the iceberg analogy is perfect. The fact that you're only seeing the tip of the iceberg. When we have patients come into the emergency department, or I'll have patients come into my office as new patients, and they said, "Oh, I had plastic surgery when I cut my lip open." So that's nice to hear, but once again, I think it's a misnomer, and patients are unclear as to what we do, because the breadth of what we do is in fact vast. So, and there are so many subspecialties within our own specialty. So I think a discussion like this really kind of clarifies to our patients and to the public. And what we try to do with the American Society of Plastic Surgeons is make the general public aware of how large the breadth of plastic surgery is. The fact that we have members who are performing face transplants, hand transplants, they're doing gender dysphoria care, they're taking care of patients from an aesthetic standpoint, they're performing breast cancer reconstruction and all forms of cancer reconstruction. So again, from a functional aspect, I think patients are certainly much more savvy now. I think that the information is out there, and the general media and the social media outlets are replete with plastic surgery stories, again, for the good and for the bad. But I think that people are a little more responsive now and understanding. I think we're getting our message out there, but I think we still need to clarify and educate the general public. When patients come in and say, "Oh, I never had plastic surgery," again, I think that's just a little opportunity for us to educate our patients to, again, the scope and the breadth of what we do in all fields, whether it's, again, cosmetic surgery, or because it's where the just patients naturally go, and the general public goes, the media goes. And I think that, this is a perfect opportunity to make everyone aware of how plastic surgeons rebuild lives, rebuild communities, and restore patients' self-confidence regardless of what we're doing.
Mhm. Absolutely. And anecdotally, I had heard that the reconstructive arm of plastic surgery kind of was hit hard during COVID. Did you find that to be true?
Yes, I think that unfortunately, in many different aspects, the ability to perform elective surgery during COVID, was very limited. And, this was just kind of a geographic thing, because many of us who practice outside of major metropolitan areas or in major metropolitan areas, we were the last people to be let in the operating rooms. I said earlier that I run a general surgical program. My residents operate out of a large metropolitan hospital, and we were platooned. We took our residents, and they were our entire PACU or recovery room was converted into an ICU run by my general surgical residents. So it was probably 6, 8, 10 months, and then patients were apprehensive about having reconstructive surgery. Many patients had delays in their diagnosis, and we're starting to see the literature come out because of this right now. So it was an unfortunate time. It was a huge learning experience for all of us. And I think that, we're past that now, fortunately, but we did see some delays. We saw many patients may have had their mastectomies, and they didn't have the opportunity to have cancer reconstruction because of the timing and just because of the prolonged exposure, possibly in the hospital. So again, I think it was a huge learning opportunity for all of us. And I think that we're maybe more prepared maybe for the next pandemic. I'm not really sure, but it is something that hopefully it's kind of self-corrected itself, and patients have had the opportunity to regain function, have their reconstructive surgery during this time. But we definitely saw the numbers drop off for more than just the several months of the shutdown. Probably lasted a good 12 to 18 months.
Wow, that long. Dr. Shermack, confusion about what plastic surgery is and is not is pretty prevalent. Is there another misconception about plastic surgery that you feel needs to be addressed or corrected?
Well, there are quite a few misconceptions about plastic surgery, and I've thought quite a bit about this question. I First of all, want to say, and as I alluded to before, all plastic surgeons are not created equal. So, Dr. Pimple Popper is not a plastic surgeon, for example. And, cosmetic surgeons, aesthetic surgeons, again, we really need to do our research and make sure that you're seeing a board certified plastic surgeon. I would say that plastic surgery is not just for celebrities, nor are all plastic surgeons celebrities themselves. The interaction between a plastic surgeon and his or her patient is a medical visit. It's a medical relationship. It's guarded by the Hippocratic Oath that we all want to do no harm. We want to be compassionate. We want to be private. We want to be empathetic. So this is not necessarily like what you see on TV. This is real medicine, and we take our role as doctors just as seriously as we do the fact that we're plastic surgeons. The results of plastic surgery don't have to look weird or make you look different. Unfortunately, some celebrities have I guess, made it seem like plastic surgery is going to make you look weird or different. We constantly see, and I'm not even going to mention the names. Everybody knows the names who they see on social media who, suddenly, come out from under hibernation and look like a different person. So Dr. Greco talked about plastic surgery being restorative, and I would say that's restorative medically from cancer, trauma, injuries. But it's also restorative with regards to aging, with regards to confidence, with regards to, a big part of my practice is patients who have undergone significant weight loss, have realized incredible medical gains, to their health, but look not so great with all the extra loose residual skin that they have from before. So I would have to say that the results of plastic surgery, I'd say primarily are to make people look like themselves, look more restored, look like the person they expect to see in the mirror. I had a patient recently who is, a very fit mom. She's in her late 40s. She really wanted to get a breast augmentation because her breasts were super deflated after having babies and breastfeeding. And she wanted a small implant that would match and be proportionate with her size so that she would feel more confident in bathing suits, at the gym, and clothing. And she had, a pretty small implant that matched her small frame. And she said, "This is great. This is the most non-boob job I've seen. And I am so happy." And I'd say, a lot of people see me who want a facelift result that makes them look like themselves. They don't want to look at the mirror and see something that looks different than what they would expect. That is a very scary concept to me. So I would say that, the results do not have to be freakish or unusual or different. We're really aiming to meet patients' goals, which is often more of a restorative end result. Travel plastic surgery is not necessarily cheap. And, people think about traveling around the country. People think about traveling outside of the country. And they do it because they think it's less expensive. It's like, combining surgery with a vacation. And I couldn't say, more strongly that that is just not the correct approach to, embarking on a plastic surgery journey. The best thing is to find someone who's accessible within your community, who has good credentials, who you develop a relationship with, who will be with you before, during, and after your procedure is done. So we call it, travel plastic surgery or any kind of, we don't like to endorse that. Some people think elective surgery has no risk. If you choose to undergo surgery, it's easy. Like there's nothing to worry about. There's nothing to prepare for. And we do like to say, again, this is a medical procedure. It's a surgical procedure if you do decide to move forward with that. And we need to treat it, with respect and educationally, and approach it carefully. And the surgeons all approach elective surgery, with the utmost protection of safety and caring for the patient. So elective surgery, just because you choose to do it, doesn't mean it's not a surgical procedure like any other. We treat it very carefully. And finally, the other thing I wanted to say is that, a lot of patients now are in social media groups or Googling all kinds of information. And generally, when you kind of come into a plastic surgery relationship, you need to understand that your doctor truly wants to take care of you. Your doctor has a lot of experience and wisdom. And it's always best to kind of work in conjunction with your physician to determine how to best, embark upon surgery, approach recovery, things that you should be doing. I can't tell you how many times patients come in to see me and have had, adjunctive therapies after surgery that I never mentioned or recommended. And my assistant and I are just kind of like, oh my God, they just tweaked that nerve again on us. So anyway, we are accessible to our patients. That's part of the contract. So if patients, have questions, you should understand, like when you come into this, you are getting a comprehensive care provider who wants you to do the best that you can and who wants to provide comprehensive care. So no need for, support groups are nice, but they should not be the end all be all. Google is quite helpful. It's good, when you want to order, something that your doctor recommends. But I would say, that's another little thing that I wanted to throw out there, is that when you develop a relationship, you shouldn't be left figuring anything out. We're a full source before, during, and after, like I said before.
Mhm. Right. Dr. Google is not helpful when it comes to plastic surgery.
Caitlin, can I add something to Dr. Shermack's?
Absolutely. Please
Again,
do.
it was a great, Michelle, that was a wonderful explanation. And I think just to kind of springboard off into the medical tourism, first off, I think that, Michelle so eloquently stated that as board certified plastic surgeons, not only do we have a responsibility to our patients, but the American Society of Plastic Surgeons holds everybody to a moral and ethical standard. Patients can just, bring up anything they want as far as, to the society if they feel that, whether or not there's been some concerns about their care, so we all practice, we're all physicians first. And, as Michelle mentioned, all these decisions to move forward, this is shared decision making. We're sitting down in a room, we're getting informed consents from our patients. So when we talk about things like medical tourism, I know that we've put out several statements. I know that I've been interviewed by several magazines about this. There's a variety of things that patients can sometimes be confused by. We talk about the cost of medical care in the United States. However, it may be attractive to go somewhere else. And I always tell my patients, where are you comfortable having your complications? So, and that's something that, everybody has to understand that, surgery is still surgery, regardless of whether it's cosmetic surgery, it comes with risk. And there's risks of blood clots, there's risks of travel, there's expenses, and are you prepared to handle all of this? And one of the things that, we often address, and even just medical tourism to other states, do you have a provider that physician has given you the names of to take care of, if you come home with a drain that you had surgery in another state, who's going to take care of that drain? Because we've had reports of, these patients, just their providers saying, just go to the emergency room. And it's unfortunate that this happens, but this happens. So again, I think that these are things that if you go to board certified, morally and ethically, obligated people, and you do your research and do your homework prior to picking a provider, I think you can eliminate a lot of the concerns that we as plastic surgeons often see, hear about, and are shocked by. So.
Yeah, Dr. Greco, like you said, sometimes people think that they're saving money on the front end, but if you have a problem, then you're going to be spending a lot more money and a lot more difficulty with your recovery on the back end.
It's like that saying, penny wise, but pound foolish, for
Mhm.
sure. And so, Dr. Greco, Dr. Shermack touched on this, but I'd love your thoughts here too. So, plastic surgery is not superficial in terms of its impact on patients' lives and even within the cosmetic realm. So, these cosmetic procedures often address issues deeper and more complex than just pure aesthetics. What would you say to patients or people who believe that this category of plastic surgery perpetuates an unrealistic standard of beauty?
So, I mean, it's a very complex question, right? So it's everybody's perception. We operate on people who necessarily don't need operations, right? This is the nature of purely aesthetic cosmetic surgery, elective surgery. So the perpetuation of an unrealistic, whether it's some ideal of what beauty should be, again, this is where picking the right provider is very important, where you have realistic discussions about your expectations. Again, I think that a lot of the expectations that may be set, and again, the perpetuation of unrealistic expectations, this comes from various places. This is talk amongst friends. This is from social media. And again, I hate to keep bringing social media into this, but it's so pervasive that I think everything that we do, we have social media fights every day, because in as much as our patients come in and they're holding up their phone and they're showing us whatever. And I think one of the biggest issues is that the general public now equates likes and followers to competency. And I think that's really a real failure on our part to educate our patients. Just because someone's popular on social media doesn't necessarily, nobody's going to put their bad outcomes on social media. We know that's true, right? But you have to have open, honest discussions. I think one of the things that we do as board certified surgeons, we're data driven. We're going to take the information. We now have we have multiple realms of what we call PROs, or patient reported outcomes. We want to know that our patients are happy with their surgeries. So we do this. We're data driven people because we need to have evidence based, because you can't just walk into an operating room and do an operation that doesn't have evidence supporting it, that it in fact works. So we need to know this, whether you're reporting to a journal or submitting an article. There's peer review and there's a process. And we know that with aesthetic surgery, the lines can be blurred a little bit. So patient reported outcomes are really helpful in us getting this data. And we know that patients who decide to have cosmetic surgery, aesthetic surgery, are usually very happy with their decisions to do this. Of course, there are complications, there are outcomes that, may not be or meet the patient's expectations, but we as surgeons, especially the preoperative education, it's our duty to really understand the patient's expectations and also manage the entire operative and post-operative course, and certainly manage expectations. So an unhappy result does not equate to a bad surgery. So again, I think that's always a failure. And all of us, when we started, I've been in practice for 20 years. And when I think about my early decisions and some of the surgeries I've performed, and you just learn so much. Every year you change your practice, you change your preoperative planning, and you change your preoperative discussions based on, what, I should have thought about that. I should have had this discussion. So I think it's expectations, and it's education, every step of the way, from that initial consultation to, the entire postoperative course. It's about managing the patient's expectations. And again, I don't think we're setting or perpetuating unrealistic goals, I think that's happening outside of the realm of the actual plastic surgeon. And this is just something that's been portrayed, because this can be, it doesn't matter if it's an entertainer, whatever. There's lots of body image expectations. There's lots of stuff out there. We just happen to be the people who can achieve these results for the patients. But I think these expectations are set so in so many other parts of our, our being, whether it's, socially. So again, we kind of may be the lightning rod for some of that. So.
No, absolutely. I know when I had a cosmetic surgery, I was surprised that my plastic surgeon was just as invested in my recovery as I was. And aftercare dictates the success and results of a procedure, but everyone on social media, to your point, loves the before and after photo. And often showing those on the table results is deceptive, especially for BBLs and liposuction, wouldn't you say?
Everybody loves a good before and after. And I think that there's a lot of deception that does occur. I think that, and this is my personal opinion, I will state this as my personal opinion, but I rather be worrying about my patient than my photograph, my video, or whatever else is supposed to be happening in the operating room. I think that befores and afters have to be explained. And you have to have, you have to show scars. You can't cover up your scars. You have to show the reality of what plastic surgery is. So, again, I get it. And I keep saying that plastic surgery has now, because of social media, has become performance art, right? So it's just something, we're no different than, someone in some gallery somewhere doing something to the shock value of it. So, and again, I would love us to back away from that and go back towards being doctors, worrying about our patients. And I in no way intend us to make it sound like anyone who puts up befores and afters. The on-table results are amazing. I mean, I stop and I look at all of them. I'm like, wow, that's fantastic. And again, I would love to see the 6, 8, 10, 12-month result as well. But I'm like, wow, that's terrific. So again, it makes me stop. So it's making everybody else stop there. I think our job is to just continue to educate our patients and educate the general public. Our society's role in this is education, patient-facing education, to let people make informed decisions about the process and about the procedure that they're about to embark upon. That's all.
That's a great answer. And Dr. D'Souza, over your years as a practicing plastic surgeon, are there any incorrect beliefs that patients have had that you've had to correct?
Well, again, I'm at the university, so we're doing a lot of reconstruction surgery, but I always have to remind people ask me, do you do more than this? And I say, yes, I do. We were trained to do so much more than this. So I have to educate my patients that not only can I rebuild your breast after breast cancer, but if you feel uncomfortable after you've had 2 or 3 babies and maybe your abdomen doesn't look like it used to, I can also fix that. Or after, like Dr. Shermack said, we have a lot of patients that have had bariatric surgery and their skin doesn't reflect the way they feel. That's what we're there for, to be able to help restore their form and their function and to help build their confidence. So I think people don't always realize that it's a whole package. You don't really have to feel the stigma of plastic surgery, because we're not there just for the before and afters. We're going to be there so that you feel like the person that you feel like on the inside. So we are trying to build you from the outside to match what you feel on the inside.
Yeah. And in your mind, what do you believe to be one of the biggest misconceptions about plastic surgery?
Well, I think a lot of misconceptions have been said, and I think Dr. Shermack did elucidate on many of them. I think what I'd like to add is, you don't have to be older to have plastic surgery. And I think people realize that now because of social media. So if you start younger, maybe with the neurotoxins, then you don't develop as many wrinkles when you're my age. So you can start younger. And because we have the training and the expertise in understanding physiology and anatomy, we know how to apply these medicines to younger ages and older ages too.
Mm-hmm. And this year's ASPS Trends Report actually showed that to be true, that demographic, the millennial demographic, is rising when it comes to plastic surgery.
Yeah.
Mm-hmm. Dr. Shermack, do you think that these misconceptions about plastic surgery impact and keep the stigma around plastic surgery alive?
So I would actually flip that question and say that I really don't think there's as much a stigma about plastic surgery like there used to be. A lot of there's so much out there. You alluded a lot to social media, and social media, I'd say, we see some of the most popular social media is associated with plastic surgery related areas, injectables being one of them. We earlier in last year saw Marc Jacobs got a facelift, and this is a finally a famous designer who looks amazing and is just coming out and saying, yes, I did this, and I want you all to know because I want to be completely transparent about it. So you can see not only are these amazing looking people we see on social media are actually doing things, and I unfortunately feel many deny that they are doing stuff, or kind of using very careful language about it. So it's great seeing celebrities starting to come out and tell their stories, whether it be, again, Marc Jacobs with his facelift, or, years ago when Angelina Jolie, told the world about her having the BRCA gene and undergoing both side mastectomy protectively and having reconstruction. That was a big story. And, it really kind of opens the conversation. I think, there really isn't as much of a stigma anymore. I think that younger people, like Dr. D'Souza said, are, coming in for littler procedures. We used to see when people would do elective surgery, they would come in, when they needed kind of, we used to say TWT, the whole thing, there would be a 70-year-old woman coming in and getting just her whole face done at one time. And now people are taking, little steps along the way. So I would say that people aren't necessarily talking about what they're doing, but there's not even so much of a stigma if someone gets a little bruise from Botox. Some people consider it to be, a sign of privilege. So I actually feel, and I don't know if the co-panelists feel a little differently, that fortunately, people are opening the conversation about plastic surgery, and that is a good thing. And so people aren't afraid to, proceed with it. People aren't afraid to say that they've had it done. I was going to say admit to it. But there's more conversation going on. And I think that's always a good thing.
Absolutely. Dr. Greco, what do you think? Is the stigma alive?
The stigma, I think, is being destigmatized, right, over the course of time. And just like Dr. Shermack had mentioned, Dr. D'Souza had mentioned, one of the things that's happening is we have so many talented surgeons, right? We have a bunch of really bright, talented surgeons out there who, I just wanted to kind of just back off to the reconstructive portion. The reconstruction results these days, they're so good, right? Your breast cancer reconstruction patients have such great results that they have aesthetic expectations now. This is I think the 100th year of Harold Gillies, and there's a brand new book that just came out about Dr. Gillies. This is kind of the father of plastic surgery, if you will. And they were just talking about, people's faces who were blown off and all the reconstructive procedures that were done just to restore a little bit of function versus wearing a tin mask. So it's a fascinating book. And the fact is that, our reconstructive colleagues and our research, colleagues, all these things that we support as a society, the results are phenomenal now. So again, patients' expectations are reset. It's no longer, be happy with what you got. It's let's restore you to as close to normal as possible. So the perpetuation of the stigma of plastic surgery, I think it is being demystified, destigmatized, because patients are proud of the fact that they're able to actually do something about what bothers them. We do it, every 10 years, you stare at your kitchen and your bathroom and you think, why did I make that choice? And if you can do something about it, and I think if you have the options, if you have the right toolbox, if you will, you have the appropriate doctors, and these are big decisions to make. I think people are talking about it more. I know that my patients benefit from online chat groups about things, they kind of want to talk about and just their entire plastic surgery experience. They talk about their pre-op, they may be posting stuff and their whole post-operative experience. So again, there's a lot to it. It's complex. However, I think that the social destigmatization around plastic surgery, is actually happening. People are fairly proud of the fact that, they feel better about themselves. They look better. They're certainly more confident, whatever it may be, but it's our job to make sure that people are doing whatever they're doing for the right reasons. And that's where the experience of, your surgeon comes in, that you're choosing the right patients and, you have realistic goal setting together and your decision making. So again, I think that patients are happy to do this and they're happy to talk about it.
Mhm. And those stories are so crucial, especially for things like mastectomies, to know that, that's not the end. It's, plastic surgery can help rebuild them and their confidence as well.
It's amazing how many patients will come back after their breast reconstruction and just want to be larger, like an implant exchange, because they love their result, but they think it looks great, but why not get a little more? So again, these are things that we all experience, again, because the reconstructive, our entire reconstruction armamentarium, regardless, has gotten so good and due to the work of so many of our really bright colleagues. So, we're very fortunate to be able to practice, the reconstructive portion of this, great profession. And the patients have just benefited so much.
Absolutely.
I'd like to add on what Dr. Greco had said earlier about with COVID-19, it did slow down quite a bit for a few weeks, and we were somewhat blessed that our slowdown didn't last quite as long. But once the restrictions were lifted, I was a very busy plastic surgeon because that COVID made us reprioritize what's important to us. And all of a sudden, it was much more tolerated that you take care of yourself. And so people that were sitting at home and thinking about doing this, well, now what's the excuse, So we got very busy with cosmetic surgery because people were ready to start taking care of themselves. And so it was a good time for cosmetic surgery as well.
Definitely. Well, that concludes our panel on misconceptions about plastic surgery. I'd like to extend a very special thank you to Dr. Greco, Dr. Shermack, and Dr. D'Souza. Thank you so much for joining us.
Thank you for having us.
Thank you.
Yeah, thanks for having us.